there is rabies prophylaxis. If somebody's bitten, about 90% effective alone is just wound care. First of all, if somebody's bitten by a rabid animal, there's not a certainty that they're going to get it anyway, because the animal has to be transmitting the virus through the saliva at the time. And sometimes a bite doesn't even have saliva in it. Either it's a dry bite, or if they bite through clothing, a lot of times the saliva will be absorbed into the clothing and it won't even get into the wound. But that said, assuming saliva gets into the wound, good scrubbing out of the wound immediately after it happens can eliminate most of the virus that got into the wound before it can take hold and start spreading. So that alone, if somebody's in a situation where they don't have access to inoculation, if they're in the back country somewhere or something, that will be 90% effective in preventing getting the disease in the first place. But there's an inoculation. There are two shots they can give. One is rabies immune globulin, which is actually the antibodies that will fight the infection, and that's given with the first shot. When somebody comes into the emergency room and they've been bitten by a rabid animal, for instance, they will inoculate them with this rabies immune globulin, and that will help contain the virus. And then the shot is like with the COVID vaccine, it causes the body to produce its own antibodies against the virus. And the one big advantage we have in fighting rabies is that it's a slowly developing infection. It's not like a cold where you get exposed to a cold or COVID or something on Monday and by Thursday you're very sick. Rabies, it's more like you get bitten on Monday and maybe next month you get sick, or maybe even longer. It takes a long time for the infection to develop. So there is a fairly wide window where somebody can take the prophylaxis and it can still be effective as long as it's taken before the disease actually sets in and you have symptoms. Generally, the prophylaxis is effective. Obviously, the sooner the better, because you never know how fast it's going to happen. But if somebody is bitten and they find out a week later that the animal was rabid and this person's still not symptomatic, it's still not too late to take the vaccine.